Right, we'll come to order. Thank you everyone for being here. Looks like we have a quorum. First thing on today's agenda, review and revise the agenda. Any revisions to today's agenda?
Mr. Chair, members of the board, I do have a few announcements if time permits at the end of the meeting.
Thank you. Anything else? All right, next meeting, meeting minutes from our March 26, 2026 meeting. If everybody could review those minutes, any revisions to those minutes? All right, none. The minutes will be approved. Moving on to our next agenda item, introductions, new staff, and employee of the quarter.
All right, Mr. Chair, members of the board, I am really grateful that I don't have a new staff to introduce to you, which means that we haven't needed to hire. Unfortunately, that won't be the case at our next meeting. I hope that we will have a new staff hired. We did lose Kirsten LaRoche. She works for Water Quality Protection as the water quality specialist. Her last day was yesterday, and so we're working on getting her position filled. So next time we do introductions, you'll hopefully get to meet her replacement. But I am thrilled to present our employee of the quarter. Adam Mays is with us today, and I wanted to have him come and so we can embarrass him.
Yeah.
We'll make his face turn really red here. And I'll just start by saying that 4 different nominations came in from 4 different staff asking that Adam be considered for the employee of the quarter. He has done an absolute phenomenal job supporting our newly formed A team, our administrative support team, helping them really learn and understand what it means to support the environmental health work that's happening in the department. And he's done that in a real personal way. He's done that by going up, sitting with them, getting to know them, helping them through answering questions, and just being really patient and really helping our staff understand not just what needs to be done, but why it needs to be done. He's taking the time. And he's just a darn joy to have around. Sandy is part of the A team. She leads the A team. And so I'd like to also prompt her to say a few things because she was part of those that nominated him. The flood of nominations that came in for Adam.
Yes, and we'll make him blush a lot. Adam is great. He's great at his job. There's not a day that he doesn't come in with a smile on his face, ready to face whatever it is, whether he's going to drive out to American Bar or wherever it is, changing air filters, doing all the different things. But he's really incredible at working with a variety of people. So there's all the different types of folks that come in from the community that need help, but then the A team, where there are 3 different people all learning a new system, learning about environmental health and all the different parts and pieces, the regulatory part of it, permits, applications, and each one of them learns in a different way, understands it in a different way, learns it at a different speed. And so it doesn't matter if you ask Adam the same question, what's for coffee? What's for coffee? What's for coffee? You can ask him 25 times, he'll still answer it. And never once will he'll say, well, didn't we talk about that? He just continues to show up. He will drop everything to help. And he's just really, really patient and really supportive of not just, like Brenda said, not just telling them how to complete a task, but wanting to educate them, to include them so that all 3 feel like they are a real part of environmental health. And it has made all the difference in the team feeling like they are growing and they are part of it. And they feel like he's just been a really good teammate. So we wanted to embarrass him.
Sandy.
Is he sufficiently red?
Almost, yeah. We have Beth is his supervisor, and I asked that she come this afternoon also and continue to pour praise.
Oh, I don't know where all this is coming from, but no, Adam's been really great. He's been here for a couple of years with us, and he's easy to supervise. He's again, always ask questions, which I appreciate. This job, being a sanitarian is not the easiest thing. And I was told almost 20 years ago, give it a couple years, and even then you're still not gonna know it. And he, has definitely embraced that and never gets frustrated with the gray areas that sometimes we live in. And yeah, he's just really learns quickly and he's great. And yeah, he's a team player. So he's always willing, yes, to go do the things that maybe Jay and I don't want to do after all these years. So very well deserved.
Yeah. Yeah. So big round of applause. Yeah. Thank you for being so darn great. We appreciate you.
Thank you.
Yeah, you're awesome.
Thank you. Congratulations. All right. Way to start on a high note.
I know. Best way to start a meeting.
Yeah. Moving on to agenda item number 3, 2023 to 2026 strategic plan closeout.
All right, Mr. Chair and members of the board. I have the privilege today to give you the closeout report on our current strategic plan. Chose to do this in lieu of having a bunch of different staff come through. So I get to be their spokesperson, but I just want to reiterate at this point that I wasn't the one doing the work. There is incredible staff in this health department that are very passionate about the work, and what the update that I'm going to give you today really does reflect all of that hard work. The report in the packet goes on for days, and there's a lot of detail in there. This report comes right out of the system that we use to track the progress that we make on the strategic plan. So what you see in this report is really 3 years worth of work. The gold bars indicate things that we intended to do and we got done. You'll see a smattering of green lights in the report as well, which means that we did pretty darn good. We may not have fully realized what we hoped to with a green light, but we got the majority of that work done. Yellow lights, we got it started, didn't get it finished. Red lights, we didn't get it started, didn't get it finished. So a handful of those that you'll see throughout the report as well. And I'll point to a few of those challenges, but I'm going to start with the good stuff. So like I said, this report goes on for days. And so I'm just going to pull a couple of the things out that I really want to highlight, but the report is there for you to read in its entirety with all of the notes. So in the first initiative, we had 5 initiatives in our current strategic plan. The first was all around health equity and social determinants of health. We did a really enormous amount of training in this area throughout the 3 years. We did a lot of cultural competency training and social determinants of health training. We did some lunch and learns. It's been a little while ago now, but we had some refugees come from Afghanistan. A couple and their child came and just helped us to kind of understand about their culture. We felt that was really important because in our clinic upstairs, we have immunizations, we have WIC, and we have home visiting services. And our staff were starting to engage directly and provide services to the families that had been relocated to the United States when things kind of went south in Afghanistan. And so to learn about their culture and to hear from them directly was really powerful for our staff. And the feedback was that our staff did feel like they were more capable. They had more tools to provide service to this particular population in our community. That's just one example of many different types of training that we did throughout the 3 years. We also finished a customer satisfaction plan. So it took us many months to craft a plan that really reflected how we want to go about collecting feedback from customers or from the public about the work that we do in public health. What's special about the way we're choosing to go about gathering customer feedback is that we're asking the public to sit at the table with us from the very beginning. So historically, or kind of traditionally, what you would see happen is that organizations create a customer satisfaction survey. You send it out into the world and hope that some feedback comes, and then may or may not actually do anything with the feedback that comes in. We said we don't want to do it that way. We want to bring in people from this community to help us decide what questions to ask, how to get those questions out to the public, how to have conversations with various populations in the community. And then once we get feedback in, we want the public to participate in the analysis of that information and also to help us action plan around what to do differently in order to reach the people in this community better. And so we did complete that plan, and we are now launching a pilot this year. So our home visiting and our WIC programs are going to be piloting our new customer satisfaction plan. So I'll be excited in the future to come back with some of the information of how that went. We also included health disparities in our community health assessment. This was done in the past, but it wasn't done as well. I think in the most recent community health assessment, we did a much better job of kind of highlighting where the disparities exist in our community. I think we may have shied away from doing that in the past because we have a tendency to focus on the positive around here. And so it's really easy for us to show all of the great things happening in our community in our assessment. But it really is important to highlight where the disparities are happening, because that's really the work that we as a community need to be doing. And so this most recent iteration of our community health assessment, we did a much better job. It has a whole section. So if you remember what that report looks like, it has a whole section addressing disparities in the community. So those are just a few highlights from our first initiative. The second initiative was all about improving behavioral health with a focus on wellness and resilience in the community. We did, again, quite a bit of staff training. We did de-escalation, resilience. We did some substance misuse and suicide prevention training. And that was just internal. That's just with our staff. We did quite a bit of behavioral health training out in the community as well. Our substance misuse coalition was developed. It's called the Strong Roots Coalition. That's actually the coalition meeting that happened in this room right before Board of Health, and who offered up their coffee and their dive treats to you all. This is a group of community partners that are really dedicated to addressing gaps in service around substance misuse in our community. And so they're a dedicated group who have really come together and fleshed out an action plan on how they're going to work together to improve services around substance misuse in the community. They've done a great job of building community capacity on this particular topic. And then we have, as an organization, worked really hard to make sure that we have the Crisis Now model available in this community. It's three pillars of services in this community that address behavioral health crisis. So 988 is a number you can call if you're experiencing any kind of behavioral health crisis. Mobile crisis response is available in this community. Service provider St. Peter's Health. We worked really hard to get that back up and running again. And then I am so excited to say that the Journey Home is reopening. Their plan is to reopen next Monday, the 27th. One of the announcements I have for you today is that they will be doing an open house tomorrow, starting at 11 at the Journey Home. So if anybody has a little bit of time tomorrow, I highly recommend. They're going to do a really nice ceremony at the very beginning, right at 11. But if you can't be there at 11, come sometime between 11 and 3 and get a tour of the facility. Many Rivers Whole Health is the service provider, and that has been a long time coming. 2019 is when that closed. And so we've worked really hard with community partners to get that back open again. So those are some highlights from our behavioral health initiative. The third initiative is all about improving health across the lifespan. So we had a focus on early childhood, youth, and older adults. I drug Fred into doing presentations today because otherwise you would have listened to me the whole meeting. And I promised I wouldn't do that to you ever again. So he's going to help tag team the next section of the new strategic plan. So improving health across the lifespan, we have our Healthy Communities Coalition that's working really hard on aging well initiatives in the community. So again, a group of community partners that are coming together and strategizing ways to make our community a community that you can age and maintain health in this community. They're working really hard on lots of different things. And aging well designation is one of them. The city of Helena has already adopted the aging well initiative or aging well designation. And so they're working on the city of East Helena and Lewis and Clark County as well. We have staff that have been trained in adverse childhood experiences and then also positive experiences. And those trainers have done a lot of internal staff training as well as external community trainings as well. We arranged for a mobile mammography event to happen in Augusta. So that's a really great example of work that we're trying to do outside the Helena area, get up to Augusta and some of the other rural areas of our county. And then another one of the announcements I'll have for you in a bit is that we've launched the Neighborhood Block Party Initiative. I'll talk about that towards the end of the meeting when I give you some more announcements. But that was really exciting for us to launch that initiative to help create more connection across neighborhoods and also preparedness. The fourth initiative is all about a safe and healthy environment. And so we had focuses in the areas of environmental health, built environment, and public health preparedness. A lot of work occurred in water conservation, education, and outreach. And then we also hosted a multi-agency, highly infectious communicable disease tabletop exercise where we had 5 or 6 community partners come here to the health department and work through multiple hours of how we as a community are going to work together to respond to highly communicable disease. It just so happened to be a measles tabletop background. And then the last initiative was improve public health infrastructure. So that initiative was really focused on what we needed to do to make sure that we as an organization are strong and healthy and can provide service to this community. And so again, lots of documented professional development to help innovate in the area in public health, and that we are using best practices to do the work that we're doing. We improved our internal communication. We adopted Microsoft Teams and are using an electronic bulletin board to have good communication internally across the department. And then some advocacy work that also happened, which you all know about because we were able to get licensed establishment fees increased during the last legislative session, which about doubled our revenue for licensed establishment after that. So those are some highlights of really great things that happened in the 3 years that we had our current strategic plan. The areas that we struggled and didn't do as well, the Connect referral system, you'll notice, is named in a handful of places throughout the strategic plan as a tool that we would use to help connect people in the community to a variety of types of service, with early childhood services or aging services, or it's named several different times. And the Connect referral system at this point is barely supported by the state of Montana, and it's no longer funded at the local level. It's a system that we had a lot of passion around because it's a good tool to really help connect people who need a service to that service and have it not be a burden to them. Typically, I'll just use you, Shannon. You come into the health department and you would express needing something. We didn't have that something. We would say, here's a card or here's a phone number. Good luck. Let us know how it goes. The referral system really puts the responsibility on the agency rather than the person that's needing the service. So we put the referral system into the referral system, and it gets to the other agency, which then prompts that other agency to give Shannon a call and say, hey, what can I do to help? Let's get you an appointment, whatever the case may be. And so when used, there was a 80% connection rate for people who were needing to connect to services in the community. The biggest problem is that not enough agencies were agreeing to use it. And so it's really hard to have a system that there's only a handful of agencies that you can't serve the public that way. And so it's been something that we've kind of limped along for almost 20 years. I brought it with me from Youth Connections when I was there, and I convinced the health department to take it on. And it's something that it's struggled, and we're probably just gonna let it go. Try not to get choked up about it because I really believe strongly that it's a good tool. Circle of security is also one of the things that you'll notice has a red stop sign next to it. Circle of security is something that one of our staff that retired was really passionate about, was fully trained in, and was offering groups and classes. It's for families that are raising kids to help build skills. When that staff person retired, we no longer had the staffing capacity, or the expertise, the experience, or the training to do it. So we weren't able to continue that. There's a whole section in the environmental health initiative number 4 where we wanted to tackle some climate change work, and we just did not have the staffing capacity to tackle it. So that whole section that we said we wanted to do some climate change work, you'll see that it's red in the report. We also wanted to have a kind of an emphasis and a staff person dedicated to diversity, equity, and inclusion. And for budget reasons, we just haven't been able to have a dedicated staff person. But what we've done instead is just have a shared responsibility across the health department that we're going to do some training and understand what it means to serve a diverse community. And then facility, that's the last challenge that you'll see that named in our strategic plan, and we didn't make any progress towards making a transition to an adequate facility for the health department. So right now we live in this building, and we have staff staff sharing offices. We don't have adequate storage space. We don't have a space where the whole staff can meet. So when we do a whole staff meeting, we have to find facility outside of this building in order to meet. So it's been identified and has been identified for many years as a challenge, and we've not been able to solve that one yet. So you'll see in the report that one is still a red for us. So those are some highlights, some good things that have happened the last 3 years, and some challenges that we ran into as well. Which was expected. I mean, a strategic plan is a good best guess of what we can accomplish at the beginning, and we go at it the best we can with the resources that we have, and really proud of the work that we've been able to accomplish on that strategic plan in the last 3 years. So what questions can I answer for you?
I have a question. Is anything that is yellow or red, or any of those going to be carried over into this year?
I would not promise them. We took a little different approach with our strategic plan. As you all know, you were part of the setting the priorities for the new strategic plan. Fred's actually going to present the new strategic plan here shortly. And there's some work that we will probably, the facility, for example, that is something that we continue to need. And it is something that we as a health department, in order to serve this community, need to be an adequate facility. And so, but climate change, I'm not sure that our situation around staffing capacity for that particular topic hasn't changed. So it's a challenge to tackle that. It's a big conversation, and our environmental health team has a lot of passion around it, but not a lot of staff capacity to do work in that area. What I was hoping would happen is a community group would be created and we could join the effort instead of having the health department lead something. And so we'll just wait for that. We'll just wait for that. I know that there's a lot of passion in the community around it. And if there's something that coalesces, then we'll join the effort as an example. But some things may be dropped. Any other questions?
I just had a question. Do you know how many square feet do you need for offices and storage and all that?
Yeah, we're currently just short of 11,000 square foot in this building. And when we did a preliminary architect report a couple years ago, it was identified that we really need between 15 and 17,000 in order to have the space we need to do all the things that we need to be doing. So
Okay.
I say that, and I don't want to come across that we're ungrateful about the space that we're in, because it's great space. I'm glad that we have the space that we have, but it's just not enough. It doesn't meet all our needs. So, any other questions? All right, so we're going to close that chapter and open a new.
I'm gonna pop up here if I can, it's just easier than talking from the back bench. I will say, as we went through our SWOT analysis, which we'll talk about a little bit too, every single team on the wish list was a facility that had adequate office space, better AC. And then, of course, there's the ones that wanted a really nice break room, but there was, it would be nice if we had our own lab. The environmental team was like, we really need a mud room. So it's, we have a long list of things that came out of our discussions that people would like to have. Well, thanks for having me. So I'm going to talk a little bit through just sort of the process we got that we used to get the new strategic plan, why we made some shifts in it. We'll walk through really briefly what the structure is, and then make sure you understand how we'll report progress back to the Board of Health, and how we'll take a look at this in both the first year and in the next 3 years. So when we decided to take a different path for the strategic plan, we wanted to both increase the kind of scope across the organization for the strategic plan. What were we going to try to impact? And we also wanted to make sure that we were moving forward in a way that involved all of the staff. I think what we ended up with was a remarkable amount of both participation, but also real engagement from the staff and from the Board of Health that we were pretty pleased with, because I think what came out of it was something that had everybody's voice sort of helping drive what we should pay attention to. And I think we'll have that continued engagement as we move forward. A few things we acknowledged is when we looked at everything that we have in this previous plan, and we've had through 2 different cycles, it was really focused on some core work of public health, right? And really aligned well with the chip and what we were sort of tasked with. And that's one very, very important piece of what public health does, but we do a lot of other work across the organization. And I wanted to make it clear to the board that we're not dropping the ability to track all of that great work that we do. One of the things that we realize is things like the chip we track with the work plan. We have reports. One of the KPIs we'll report back to is the percentage of that chip implementation during the 3 years that's done. So even though we really shifted the structure of the plan, we haven't lost anything that we do in our day-to-day work, because it's what we're grant reporting, for reporting to the commission, for reporting to the board. There's still a lot of ways that we can manage those pieces. So what we looked at is, if people remember, the sort of core of the foundation of the plan was this balanced scorecard, right? We can make an assumption, I think, that if the board or if the staff and the public health department is running really well, it's going to give us the agility, the flexibility, the focus to be able to respond to what comes in the next 10 years. As Brenda was alluding to, it's great to have a 3-year strategic plan, but there's no way we know what public health looks like next year, the year after, the next year after that. And so a healthy, agile organization is going to have the ability and the focus and the principles to be able to respond to whatever comes our way. So the balanced scorecard idea is to look in 4 different quadrants: the financial, the customer service, the operational, and people and culture, right? Do we have each of those quadrants sort of with some focus on them. In my previous work in the private sector, this was a really important component of evaluating whether you're going to invest in or purchase a company, right? If they're making a ton of money, but everybody hates working there, it means that there's something off balance in that organization. And so we really want to take a holistic look. And so we began about 5 months ago by doing our SWOT analyses with each of the groups. So we did 8 of them total, 1 for each program, 2 for prevention, because we wanted to do prevention and chronic separately. And that was a really great effort. We sort of looked at the strengths and weaknesses that were within our influence to change, and then the threats and opportunities that are outside of our influence, but clearly exist, and wanted to make sure we recognized and acknowledged those. Out of that process, which was about 6 or 8 weeks, the next step was to go through and say, can we build key performance indicators in each of these quadrants? That one of the inputs was the SWOT analyses, but also from our own knowledge. And that was that large sheet of 29 KPIs that we used as the basis for the conversation we had here with the board in January, which is out of these 29, can we look at and prioritize 5 or 6 of those KPIs to make the core piece of the strategic plan. Taking one little step back, though, too, I think the important thing, and one of the parts of the conversation we really appreciated, was when we sat down and went through the mission and the vision and the values. One of the first things that Brenda mentioned when we started the process was it's great to be able to take a look at this, but she wanted to know what those values meant. Like, what does that mean in action? So if you're going to have leadership, collaboration, inclusiveness, effectiveness, and integrity, what do those look like? How can we integrate into how we operate as an organization, keeping those as part of the culture of the public health that we can pay attention to? So you had a great conversation in January about what each of those means to the board. We had a similar conversation a month later with the all-staff meeting, also great level of engagement. One of the things that Brenda and Val worked on, which I think is really helpful, is in your plan, is this little narrative. And on the back is something that we're laminating for all the staff. That's also included in your package. I'm not sure where it is, but it's the graphic that sort of displays the marriage of sort of from the board's perspective as setting policy, leading strategic planning, and being the governing body, and then from staff on the ground who are implementing that strategy on a day-to-day basis. How do the two look at something like leadership, and what are the commonalities between the two? So it's worth taking a read through of this, because it was, I think, a lot of work that went into that analysis, and this will be one of the core things that sort of drives how we operate as a team over the next 3 years. And I think a step up from the reference that you see on one page in the plan to something we keep as part of our discussion. Those core values help us make decisions, help us decide how we approach our jobs on a day-to-day basis. And for each of the 7 teams, they have their own interpretation within that team of what those things mean. So just to draw some attention to that. Out of the planning process, we ended up with 4 thematic goals, each corresponding to one of the quadrants of that balanced scorecard, which are on the single sheet. Strengthen the financial health and sustainability, deliver exceptional customer service, strengthen operational excellence, and foster an engaged, supported, and high-performing public health workforce. So as you look at the next step that we took after the board prioritized those 6 KPIs, we use this process of battle plans to kind of under each thematic goal to define our objective, and then come up with who's responsible for this, when is it each of the steps accomplishable, what's the metric we're going to use to measure whether we're successful or not, what resources are available within the department for implementation, and who are we collaborating with. So at a very high level for each of those objectives, we have defined those initial pieces. We did that collectively as a staff at our all-staff meeting, sort of did some refinement of it that we sent back out to staff to make sure that we got it pretty right. The next step for this is to be able to go and build a work plan. In the first 6 months, I think it'll be more like the first 4 months after we have this plan adopted by and approved by the Board of Health. for implementation. And so the one other thing I think is important to keep in our minds is we looked at these and where we're going to be. We set all of our objectives. If you look at the when they're going to the definition, each one of them has a by April 2027 objective, which means that at the end of that first year in this 3-year plan, we're going to take a look at that. Did we have the right KPI? Where are we on our progress? Is the work plan that we came up effective? Are we impacting it? And in some cases, we may even look at, if we're kind of blowing on away, do we want to look at how we can maintain that and maybe up our game by changing either the metric or looking at another aspect of that same goal and seeing if we can impact it in a different way. One of those that came up that I'm thinking of, Dr. Nast, was we had a lot of discussion at the meeting in January around the elevated lead blood levels.
Mhm.
And we think we have a good KPI defined, but part of the discovery of that includes reaching out to pediatrics, reaching out to St. Pete, seeing if we get a different denominator, if we're able to find a different measurement that we can actually identify. We may look at that in 6 months and say, with what we've learned, we're going to change that from the elevated blood level tests that we do here at Public Health to look at, can we expand through education the entirety of the population that's getting done. We have a lot of things changing. We're going to start the new projects in East Helena in June with the yard replacements, which is going to draw some attention. There might be some of those things that just happen in our environment that may lead us to reevaluate. So part of this is the management team on a biannual basis will be sort of evaluating where we are. We're going to get a report at the all staff meetings from staff every 6 months. And then once a year, we'll come to present to the board. And part of that presentation might be some of those suggested revisions and why. So we'll have the ability to continue that conversation and get buy-in and approval and move forward. So let's see if there's anything else I need to cover. Also, one of the things that I don't think you'll care much about this, but it was funny to me, is I had big plans, new guy, and we're going to find a great system that we're going to use for monitoring this system over time. And there's all these new cloud-based systems. And we did a bunch of evaluation, included some other staff. And what we found out is the VMSG that long report was printed out of, it's really kind of the best system that I could find out there, largely because it's purpose-built for public health. So a lot of the reports that you're used to seeing for strategic planning will be very similar, will look the same. And I think it really lends itself well for a consistent approach. It's also kind of tied into how requirements we have for accreditation. So there will not be a change there. The other thing we discussed here at the board meeting in January is there was a lot of passion over some of this. I remember, especially like around some of the environmental health stuff, that we as a team have decided there's 29 KPIs, right? There's the 6 that are a primary foundation for the strategic plan. But the intention is over the first 6 months to also look team by team at how we can measure and impact the rest of these KPIs, partially to evaluate whether these are the right ones that we can look at long term, but also to potentially set up for the next round, because we think they're all important. So to the extent that we have time and funding, I think we will do an additional internal prioritization of these, also based off of probably the ease of getting data and measurement, because a lot of it we measure already. It's push button measurement. So more to come on that, but I wanted to let folks know that we're not dropping those, because we think those are all important KPIs that give us an indication of how healthy we are as an organization. And so that will be just an operational task beyond the focused strategic plan. I think that's the gist of it. Are there any questions around the specifics of the plan?
I just want to emphasize the last 6 years, we maintained those 5 initiatives that I just went through. And what I can say is that it was a lot. It was almost cumbersome to try to do that amount of work. And my desire coming out of that strategic plan into a new one was to find an approach that allows us to focus and have greater impact. And so that's what we were aiming for with doing a strategic plan and the way that we did it is to land in a place where we could be very focused with our limited resources and have greater impact with the work that we do. So I think we achieved that. We'll see as we move through this first year of the strategic plan, if we're able to have the impact that we hoped with the work that we've identified. So.
I really like how flexibility is built into the process, with that first year annual review. Having been involved in a few strategic plans, they tend to have rigid thinking behind them. This is the plan, we're going forward, we're not going to deviate, we're going to make number big, right? But flexibility is a requirement because that's how the world works, right?
Well, and the world we have found ourselves in public health hasn't always been this way, but it's pretty volatile. So we can not look around too many corners to see what's coming our way. So 1 year at a time makes the most sense because that gives us the ability to be agile and adjust as things are happening in the world. So.
Any other questions or comments? All right.
And strategic plan in the health department, since I've been in my position, has never been a document on the shelf. It's never collected dust. But our previous strategic plan has been pretty rigid. Staff really didn't feel like they could make a change if we identified a change. So I think the way we're doing it this time will lend more to flexibility, adaptability, agility.
Do you think that was a lesson learned from COVID?
Oh, certainly. Yeah, certainly.
Yeah.
We got caught flat-footed and we just can't afford to do that in a community.
I think a lot of governmental agencies have found that to be true. It's easy to say these are what we're going to do and be very rigid about it, except when things hit the fan,
right?
What are you going to do? And so I think I think of it as a well-rounded approach, right? You're looking at the 4 quadrants, but a balance in each of those. You don't want to be top heavy. You don't want to be bottom heavy. You want the balance so that you can accept those challenges that you haven't seen coming. So I think it's a great approach.
Yeah. Funding changes.
Yeah.
We're really heavily grant funded. And so we're at the mercy of those that fund public health. That changes priority. So we have to be able to make those adjustments as we go. This is an action item, Mr. Chair.
Well, thank you so much, Fred. Thank you, Brenda. I'm so impressed that this is the document that we got from whatever that meeting we had in January was. That it's so much more organized. And still, I think, reflective. I think it's worth noting that, at least in my opinion, it really worked this sort of almost like U-shaped or V-shaped flow of information from the programs to us back to the programs, so that it was sort of, we were this filter of priorities, but always relying on the knowledge and expertise of the program staff. I think that was a really smart way to kind of adjust the process this time. So thank you for leading us in that. I just have a couple of correction or like revisions. They're not substantive. I think under section 2, the numbering is off. They're out of order. So just that needs to be fixed. Section 6, also the numbering out of order. And then there's a typo in section 6.3. I think NEVA it should say local and tribal. So those are my only, totally unrelated to the substance of the document.
Easily updated then.
Yeah.
This is not a rigid.
Since each of those are actually my fault, I can be fixed in notifications.
So with those changes, do we have a motion to adopt the Lewis and Clark Public Health Strategic Plan for 2026 through 2029?
I'll move.
Thank you. A second?
I'll second.
Discussion on the motion.
one of the things that, if I might, there's been really good detail in here, um, but I, and maybe I missed it in there. We need to be talking about what's going to cost to do all the things we want to do, and where we're going to get money.
Yeah. Well, that's a nice segue to the next part of the agenda.
Yeah, yeah. Yeah, I think I appreciate that comment. I think that this is but the way I understand it, this is one piece of our sort of oversight of the department, right? And so this happens in tandem with the budget, right? They work together is how I view it. I don't know. Is that am I thinking about that correctly?
Absolutely. And I would say that it's not, we do the best that we can building a budget that supports the strategic plan. And I would say that we're pretty darn good at matching up the resources that we have with the work that we want to do in the strategic plan. What deviates from that is when we have grant funding that changes on us, or there's priorities at the state and federal level that change, that don't reflect our community priorities, then we can get pulled, right? And so I would say that 90% of the budget we can say yes, that supports the strategic plan, but we have to also recognize that the way public health is funded is not based on our strategic plan. We have some control over a part of our revenue and how that gets spent, but we don't have full control over all the revenue and how it gets spent. So I like to, unfortunately, what public health across the state of Montana, and I'm going to guess that across the nation, we're not alone in this, that the grants that we get to fund our work drive our work rather than our strategic plan driving our work, and we find the funds to fund it. So it's a little bit of a push and a pull that we end up doing. And it's a dance. So good thing I have dancing shoes on.
Because
Well-
finance is a KPI in
Yeah, it's,
the strategic plan, so
It
it's
is.
carefully watched.
yes, yeah, absolutely. And when I present the budget, it's not obvious in the budget, but what I can say is that when we built the budget to support the strategic plan.
Good. So this is our guidance to the department in part on how to prioritize spending certain money that we know we already have aligned with these strategic priorities.
Correct.
Thank you. Anything else?
Oh, I keep going back to the looking for bigger offices, you know. I mean, that's a lot, what, a 30% increase in space, and it'd be a lot more money.
Yeah.
Where would that have, I mean, that's obviously what's keeping you from being able to expand.
That's part of it. Yeah, budget limitations definitely play a role in our ability to be in a different space.
Because you'd have to cut some programs probably to have additional space.
We find ways to have better and bigger space without impacting our operations and our personnel. So, which is why it's not been a problem easily solved.
Mhm.
yeah.
So, and the biggest crunch right now is just that sharing offices. And what kind of a problem does that create? I mean, is it just too crowded?
Just to be honest, in this building, we do share with Peerview, and Peerview is growing and needs space, and we are also crunched. And so we both really could use more space. So I think that there's possibilities. We just need to keep working through and hoping that stars will align at some point. So, yeah.
Are they hoping that you'll move, or are you hoping that they'll move?
I think that we need to keep both of those conversations open, because I think that depending on what's right for the health department and what's right for Peerview, it could go either way. So I think we need to keep investigating and looking for options. And when there's the right option for either Peerview or the right option for public health, then that will help drive like what happens in this building. So
It's hard because there is in a lot of ways, it's ideal to have the FQHC in town associated with the health department.
Yeah.
Yeah, it really is.
There are a lot of benefits to us being co-located,
Mm.
and we've definitely identified that as a reason to stay
Mm.
co-located. But then the challenges that come with that can be a lot. I think something that that we're all trying to keep in mind is that there was a $6 million investment in this building for the purpose of medical care.
Mm.
And so 75% of this building was built for peer review.
Mm.
It's not built for public health.
Mm.
So that part, that element of the conversation is there. So it's,
Mhm.
peer review is not a part of the county like they used to be. They're a separate nonprofit that's leasing space from the county, and it's a county-owned building. So it's
Oh,
this,
interesting.
yeah, it's this dilemma, I think, that we're all in, trying to figure out what's going to be best for all parties involved,
Mhm.
and a solution that's not going to put the county in a hard spot, or put public health in a hard spot, or put peer review in a hard spot. And that sweet spot just hasn't been found yet.
Yeah.
So,
And there's no room for expansion in this lot, is there?
no, not even up, because this building was not built to
Sustain
go up.
another
Mhm.
level.
Yeah, parking is a challenge in this
Mm-hmm.
this space, and yeah, there are multiple things happening but we come to work with a smile on our face and still do what we need to do.
Add just one thing, if that's okay. Chair, thank you, board, for listening. I just also wanted to add, it's not just a matter of staff, doubling up in their offices, and lack of storage space, but we also lack the private space to be able to greet the community and do what we need to do with them. So whether that's water quality and someone comes in and needs to talk about a water quality issue that they have, and oftentimes that can involve some health issues that they're having, which is private in nature, that they really don't want to talk about in front of other people. And we don't have a lot of space for that. So oftentimes they're kind of tucked away in the lobby trying to talk about that, while you are also dealing with, your immunization patients that are coming in. Peer review patients will come and sit in our lobby as well, and peer review staff will kind of go through there. Home visiting and WIC clients are there. And so it's not just a matter of staffing not having adequate space, but staffing lacks adequate space to be able to fully, I think, serve the community in the best way. And that's what we're always looking for, is how can we serve the community a little bit better? So I just
Yeah, thank you. Yeah.
Perspective from
Yeah.
administrative
Good.
support that
Yeah.
sit upstairs.
Yeah, that's all good information.
Who's actually trying to expand, right? Like they were halfway down starting a residency here.
Yes, yep, yeah,
And adding 9 new doctors.
Yep. I think they're continuing to expand services, so.
Yeah.
Mhm.
Which is great.
Yep.
Yep. Space.
Yeah, I think again, we're looking for an answer that works for the county, works for public health, works for peer review, and it's just in motion. Conversations continue, and yeah.
Any further discussion?
Just an observation. When we talk about space and better operation, you're competing with every other department in the county who, virtually every one of them could use more space, and all with legitimate reasons for needing it. But there's a limit to the amount of money that's there. That's exactly right.
Commercial space is out of discussion, right? It's out of reach.
Yeah.
Commercial space is fiscally not possible. So
That's right.
Any additional discussion? Do we have any board members online?
Yeah, no.
Oh, perfect. Any public comment? Looks like none.
No, Chair.
All right. All right, we'll take a vote on the motion. All those in favor of adopting the strategic plan with the changes that I mentioned, aye.
Aye.
I'm going to abstain because of the future.
Thank you for
You
doing
don't,
that.
as a commissioner, you don't have to abstain from the strategic plan. It's the budget part.
Yeah,
Okay.
and yeah, the budget, anything that relates to the budget, I have to
Right.
abstain.
So the strategic plan, you don't
Yeah.
need to.
Okay.
Yeah.
All right.
Any opposed? No, the motion passes. All right. Moving on to action item number, or not, I'm sorry, agenda item number 5, fiscal year 26 quarter 3 finance reports.
Right. Mr. Chair, members of the board, Sandy's going to get those items put up on the screen for you, but it's also on page 84. On here, it's in the pocket, I think, right around. I'm not sure. I have the electric. There we go. All right, so this is our finance report for quarter 3, fiscal year 26. So that's going to be January, February, March expenses and revenue. And so what is summarized for you on this sheet is the top reflects the revenue that we have received to date. So this would be 75% of the way through the fiscal year. We have collected 66. We have collected 66% of what we had budgeted for. And so that's a little low of the 75% of the way through the year. And the main reason for that is we get tax revenue in two times a year, in November and May. And so that next big influx of tax revenue that we'll get is going to happen in May. So you'll see that on quarter 4 finance report. All other types of revenue are either well above or at what we had anticipated. But it's the reason why the overall percentage is a little low for revenue is for that reason. We're still waiting on tax revenue to come in. Any questions on revenue? The bottom section of that same sheet is reflective of our personnel expenses only. So we're setting at just over 77% spent. So just a hair high over the 75% through the fiscal year. And then the next page is where you're going to find all of the operations details of money spent. So anything from rent and technology to supplies and gas for our vehicles. And we are sitting at,
Sorry, it's being a little, I'm not sure.
will you scroll to the next page? And down at the bottom there, you can see that we are 48% spent of what we had anticipated or what the budget said we would spend at this point. So for operations, we're well under. Oh, yes, that's correct. And then if you add our personnel expenses and our operations expenses together, we're setting at 57.9%. That's grand. So underspending our budget quite a bit at this point in our fiscal year. The ending cash balance. I'm going to stand up and show you. Our ending cash balance is down here. So it's 1.1 million is what we're setting out for a cash balance. And so that puts us at 136 days of reserve, which is over the 90-day. The 90-day would be the 736 if we were setting at a 90-day reserve. So we're well over that 90-day reserve.
I mean, 90 days is the minimum we're supposed to keep or the.
It's the sweet spot,
Okay.
right? And by law, because government's not supposed to be making money, but we need to have reserve in case, things happen. That 90 days is like best practice. And so that's what we aim for. So any questions? This number reflects where we were through December or is it through March or through December?
That's last year.
Last year, but through March. Okay. So this is where we were setting this time last year at 740,000 in our reserve, and we're at 1.1. at this point as a cash reserve.
Mr. Chair,
Yes.
just a couple questions being the new guy on the budget.
Yeah.
Is there, I guess I'll start first with the salary.
Yep.
And some is grant, some is paid by taxes.
Correct.
And so are there restricted funds, say we go over in operation, do we go over on staff?
Mhm.
Do you have the ability to move money,
Yeah.
if you will, to cover those costs without
Yeah.
affecting other lines?
Yes. And so we treat our grants differently than we treat, so what you're looking at are just the expenses in the mill.
Okay, okay.
And so those do have more flexibility. If we do need to make a budget adjustment, we work with the county and the finance director. Frank is the finance director for the county.
Okay.
And it's about this time of year when we're watching and we're monitoring, and Heather works with Frank and identifies the need for any kind of a budget adjustment, which means we're overspending in a category or underspending in a category. So we watch that pretty closely and we make adjustments through a pretty
That doesn't have to-
streamlined, but it doesn't,
Okay.
no. This is an opportunity for me to let you know how we are doing at 3/4 of the way through the fiscal year and ask the questions, but the process is really internal to the county as far as how we move things around and
Sure.
yeah.
Okay.
And there's it's a formal process that goes before commission. Yeah. The commission, just so you understand, the Board of Health, when we get to the budget, the Board of Health will recommend for adoption. And the county commission, I'll take the budget in front of county commission at the end of May. They will be the ones to actually adopt the budget.
Okay.
So the board's role is oversight, making sure that we're aligning the budget with the strategic priorities that you've set, that we are being fiscally responsible, which is why I bring the finances to you so that you can see how we're doing. But it is ultimately the county who has authority over the money.
Okay. And if categories go underspent, it's still your money, or you have to give it back, or
This is the mill, which is dedicated specifically for public health.
okay, yeah, so
Yep.
gotcha.
So it'll just stay in our cash balance
Sure.
if it goes unspent, and we can use it then for the next year. Which you'll see when I present the budget, we will be doing that.
Sure. Okay.
We'll be using cash balance to balance next year's budget.
Okay.
So having a little extra is not a bad thing when we go into a new fiscal year. Having too much is frowned upon. So
Yeah.
so we try to do that right.
Is it
Right?
capped at 3 times the Is it capped at 3 times the appropriation?
Yes. Yeah, by state law,
Yeah.
which is what Frank is watching very closely at the county level. And then he works to make sure that we're staying within the restricted amount.
Because you don't want to be too far under.
Right, right. When we've been there as well, it was only, what was that, 2 years ago or 3 years ago that we had 17 days of reserve sitting there? It was very uncomfortable.
Sure, but I mean, on the other end too,
Yeah.
not spending the money that
Right.
you receive.
Yes.
Yeah.
Yeah.
Any additional questions?
I think this is reflective of staff like Sandy, who deserves kudos for saving us money all the time.
Yeah.
So,
Can you talk a little bit about the causes of the lower than anticipated expenditures to date? Like, are people seeking health department services less, or like what's going on with that?
no, I would say that part of that percentage, the total, what is it, 57.9% of our overall budget. Part of that is because we put $500,000 I don't know if you all remember that in our budget last year for contingency in case we lost federal funding without any warning. So we have money sitting in there that we probably won't spend because we weren't faced with an emergency this year as we thought we might be faced with. And so that's going to skew.
So that money is divided amongst all of these different line items?
It is sitting in contracted services. So line 39.10, contracted services, 672,000 is the budgeted amount. You see that?
Yes.
So we stuck it there so that we would have flexibility on how to spend it if we needed to spend it. And we've not spent it.
Okay.
So that's skewing, that's skewing the percentage of spent. So if you took that out, we probably are spending right on.
Okay.
Okay.
Mhm.
Not that I'm saying spend money frivolously.
Yeah.
Well, I guess what contracted service haven't we done yet?
Yeah.
That makes sense now.
Yeah. Yeah, that was at the advice of Frank, our CFO at the county. He said, things are really volatile for public health right now, and you have extra. And I recommend that you budget extra for contingency in case you need to use it this year. And we've not needed to use it.
We thought we were going to.
Yeah, there was a couple of close calls. You know, the suicide prevention grant, for example, we had it one day and didn't have it the next with no notice. That's a staff person, right? That we would have paid out of here. So because you don't just fire somebody, without notice. So you keep them and figure it out. But yeah. Yeah. So good news. It's all good news for our fiscal year quarter. It's hard to say. It's hard to say that 100 and how many days of reserve is good news, but it is 136 days of reserve that means that we are not squeaking by. So, and we have money then to work with in the next fiscal year as well.
Good job. It's hard to do.
It is hard to do.
It's been a lot of hard work for you guys to get there too. I know Tom remembers when they're down to 17 days, right? Oh, you,
Pardon me?
yeah. You remember when they were down to 17 days? It's a lot of hard work for them to get there, and
Yeah.
good work.
Yeah. Well, and quite frankly, and Brenda and her crew have done a great job of turning things around here. And it makes it a lot better all the way through to be a little bit cautious and to have money set aside for emergencies. It's amazing how many fewer emergencies there are when you've got a little extra.
Isn't that
What is it? My mother,
Plan for
my late mother-in-law used to call it her foxy pocket. If you kept a little extra money all the time.
Yeah. This is us planning for the worst and hoping for the best, and so yeah. And it also gives us an opportunity to think about facility differently too, because in the past we haven't had a little extra, and now we might. So
We're never comfortable though.
Never
comfortable. We're always waiting.
Yeah. The tax revenue is coming in higher than what was anticipated. So what you'll see at the end of the fiscal year is that we brought in more tax revenue than we thought we would. And again, that's Frank who he calculates conservatively and he projects conservatively. So we end up having more revenue than what we budgeted for that reason, which is a good thing. Yeah, it's been good for us, I think, for him to, I think he does that across the county, but it definitely works out in our favor too.
Right, any last questions? Is that it for?
It is for the finance report.
Thank you. And then I guess moving on to the fiscal year 27 budget.
That's right. All right, Mr. Chair, members of the board, here we go. Fiscal year 27. As a reminder, our budget is broken into 3 sections. And we have our mill funded work. That's our the tax revenue that I keep talking about. And we bring in tax assessment for specific to public health, and it funds a good chunk of our work. We have Water Quality Protection District is a second section of our budget. They have their own dedicated tax revenue that comes in, and it has to be kept separate from the kind of broader health department budget. And so they have their own dedicated budget. And that also goes before the Water Quality Protection Board for their review, and they also recommend for adoption through their process as well. And then the third section of our budget is all of our grant funds. And so I'm going to go through in just summary for you each of those three pieces of the budget. We had a really great finance meeting with 3 board members last week. Lisa and Mike and Sherry were there, and we went through the details. And so at the end of that meeting, it seemed that those 3 board members are really comfortable with the details. I'll let them speak for themselves. But today my intention was probably just to summarize for the rest of the board. Lisa, Mike, or Sherry, did you want to say anything about the finance meeting last week?
It's very informative.
Yeah.
Operate within budget, and the explanation of the reserves was very helpful.
Yeah, I agree. And I was on the board when we had 17 days of reserve. So it's impressive that in 2 years we are where we are, and that's going to help us out this year with this budget to make up some of the shortfall that we're projecting. So it's good to see that the details, that even though it looks like, holy cow, we have a whole bunch of money, we are not in the money making business. It's going to balance this year's budget. So
thank you. All right, so I'm going to go ahead and use this to describe, because then I can point. So this is the mill summary. So again, these are the specific tax dollars that are coming in to support the work of public health. The green section is the different types of revenue that we pull in, and we're estimating $2.8 million in revenue, which is up from the budget last year by about $200,000. And this is anticipated. This is actual, and this actual column represents 75% of the way through the fiscal year. So you're not getting the whole picture there. This column is our actuals from fiscal year 24 and our actuals from fiscal year 25, so that you have some comparison across time. So $2.8 million we're expecting for revenue, and for expenses, we're projecting $3.2 million, most of which are personnel expenses. So what that does for us is that we have a shortfall of $481,000. And that shortfall is covered by the year-end cash that we'll have sitting at the end of this fiscal year. Will help to balance that. What we are projecting for cash balance at the end of fiscal year 27. So if we spend like we say we're going to spend in the next fiscal year, we'll still end up with over $1 million of cash reserve. But if you look down here, this is our 90-day reserve for fiscal year 27, and so it's right about where we should be. Questions on the budget for the mill? The details, again, we're not going to go through the details, but I am going to point out one thing. And so, Sandy, if you would scroll to the next page. These are all the details of the revenue. We'll keep scrolling to the next page. This starts the details of the expenses. Personnel is the first big chunk, and then operations is the next big chunk. Keep scrolling. And right here. So contracted services, we're again putting an extra chunk in there. Again, contingency, because we don't know what's around the corner. We're trying to plan for the worst and hope for the best. And we hope to have a facility solution this year. So we have a little extra sitting in there for unknowns. Okay. Any questions? All right, the next section of the Mills Water Quality Protection District, and this is their summary. So revenues, we're anticipating 425,000 in revenues coming in and 525,000 in expenses going back out again, which is they have also a shortfall that will be we'll be able to fill that gap with their year end. They have a lot of money sitting there as well, way over their 90-day reserve. This is their 90-day reserve at the end of fiscal year 26 projected, because we're not there yet. So projected. So we'll use 99,000 of that to cover their budget. So money sitting there, and we're going to plan to use it in that way. Any questions on that one? Okay. Sherry, you'll see that one again next week when you go to your Quality Protection District meeting. All right, and then again, in your packet, you get all the details. So revenue details and expense details, and we're just gonna scroll through those to the third piece of the budget, which is your grant summary. So this is grant revenue that we're expecting. So you can see that we have more grant revenue than, what did I say? 2.8 million in tax revenue coming in to support the health department. We're anticipating 3.3 million in grant revenue coming in to support the health department. It's pretty significant that we rely that heavily on grant dollars, most of which are federal grant dollars. Very, very little of it is state. Very little. We'll do that percentage. That percentage is really nice to help people understand how we're funded. A breakdown of our revenue. So 3.3 in revenues, and we're then expecting to spend just about the same amount that we're bringing in. We are using just over $1,000 of carryover. A few of our grants allow for carryover, and we do have some carryover sitting there that we'll use in the next fiscal year. Most of our grants do not, but some do. Okay, that's the third piece of the budget. So overall, good news. We have we're anticipating at decent revenue, and we've matched our expenses to strategic priorities. We have 21 grants that are funding the health department, 43 staff. So that's why you see such a high amount of budget allocated to personnel. The work that we do is people centric. I hope that
I've been here for a long time.
Yeah, I hope that AI never takes over what public health does, but we do try to use AI to be more efficient around here for sure. But to Heather's point, we have the best longevity in the county in all the departments. So we have staff that have been here for a long time. And when the county does a great job of paying staff well. So the longer you're here, you kind of grow on the pay matrix one step at a time each year. And when you get to the end of the pay matrix at 7 years, then you start earning longevity, and that longevity goes up every year. So we have some staff that have, 20 years with the health department. We had a couple retire recently at 30 years of service. So yeah, so that contributes to personnel expense, but it's well worth it to have staff that are dedicated to public health and that have continuity. And we definitely don't have an issue with turnover in the health department. It's rare.
Speaks to the culture.
It does. Yeah. 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 Staff like it here, and they like to stay here. Mm-hmm.
Any additional questions?
I didn't really get into the weeds, but the fixed expenses that we have in our budget are expenses that we don't have control over. So rent in the building, IT charges, health insurance charges, those are kind of all fixed that we're just given those amounts and then have to budget around them. So personnel is another fixed really too, because we're given that amount based on where staff fall on the pay matrix and what their benefits are. So the work that we do is in that operations section of what money are we going to use to do the work that we're doing.
All right, do we have a motion to recommend for adoption the fiscal year 27 budget as presented by Drenda?
I'll move.
Thank you. Second?
I'll second.
Thank you. Discussion on the motion?
And I do have to abstain again, so.
Yes. All right, any public comment?
Okay.
All right. All those in favor, aye.
Aye.
All those opposed? All right, and we will note your abstention. And the motion passes. Thank you, Trenda. Thank you, Heather.
I think Heather deserves a round of applause. You know that she doesn't like a lot of hubbub about it, but she works so hard. Without her, these wouldn't get done. So we are so grateful for her.
Good job, Heather.
Yeah.
Thank you, Heather. She has to be here in case I can't answer a question.
And
No pull last week.
yeah, and thank you to Lisa, Sherry, and Mike for serving on the finance committee, doing the legwork for the rest of the board. Appreciate it.
Yeah.
All right, agenda item number 7, highlights from the Board of Health track at the Confluence Annual Conference.
I'm going to put you on the spot
Okay.
since I can speak to the one session that I participated in, but I would love to hear what your experience was, and have the board hear that too.
So for those of you who might not be aware, last week I attended, along with several people from the department, but as the Board of Health representative, I attended the Confluence conference, annual public health conference in Billings. And they had a specific track for Board of Health members, as well as many other tracks for the program staff from the health department in each of their areas. And so for the Board of Health track, I will just say, I think my takeaway was that we are, for the most part, doing things right. There were presentations on public meetings and communications. There were presentations on finance. Drenda presented to representatives from boards of health from all over the state on the finance process. There were presentations on kind of just good governance as a board, and prioritizing different issues and how to go about doing that. And so it was a really great experience, and for me, it was a very affirming experience that, to the credit of Drenda and the rest of the team, we're doing things here correctly as a Board of Health, and we really, have great staff helping us do that. I will also say Drenda presented, co-presented on a presentation that I got to sit in on, and I will just kind of sing her praises a bit in that the presentation itself was good. Again, of course, we're already doing things right because Drenda was the one presenting, but just the reception that Drenda got when she presented from other board members from across the state, just the amount of respect that people have for Drenda and the amount of the way that people really listened to what she had to say. Like she was really the expert in the room, and to the point where at the end, toward the end of the presentation, there were two co-presenters, and um, people were just asking Brenda questions that were totally unrelated to her presentation. I think in part because of how well she represented the health department and the quality of the information that she was providing, and so. Um, from a board perspective, it was great. It was really affirming, but I did want to call out sort of Drenda's involvement and her the way that she was really received by other board members in the session that I was a part of, because it was really impressive, and it was a good reminder of how lucky we are to have Drenda's leadership, to have the entire team. I mean, there were several people from the department who went from the programs, but how truly lucky we are to have the staff that we do, and to have the longevity that you just talked about, because it was very clear that we are a leader within public health departments in the state. And that's something that I think is worth keeping in mind as we move forward and really trying to maintain. So it was a great experience. Thank you, Drenda, for getting me set up with the logistics of being able to go, and for organizing part of that.
We were really grateful that the state health department did some registration and lodging stipends or scholarships. So we got to take advantage of that, which was really good. And yes, we are seen as Lewis and Clark Public Health, and this Board of Health is seen as a best practice example across the state of, especially around oversight of finances and budgeting. There are boards of health that don't even see their budget. And that became very obvious in that room when I saw looks on board member faces that like, oh, we've never even seen the budget, let alone had that much discussion or conversation or a vote to recommend. And that's because the budgets are handled by the county, right? But that doesn't mean that boards of health kind of abdicate responsibility there. It just is, look, you just have to understand what role you are playing when it comes to the finance and the budgeting. But it should be on the table for you. And that's what I was advocating for. There was a few other health officers in the room, and I said, don't you dare throw rotten tomatoes at me, but if you need to go back to your department directors and ask to see the budget and ask to see the finances. If you're not seeing it, you need to ask for it. So yeah.
So you're not invited next year.
I know. That was the reason I was invited. Yeah, it was a good session.
Yeah, it was a really great session. And there was a really great, I was able to make the keynote, one of the keynotes at the beginning. There was a really great keynote address on public health communication and messaging for sort of broader like public audiences. And I think some resources that are useful for public health communication across the board and at every level that might be available. Because I know Amber, as a one-woman show, it can be hard sometimes. So that was also a really great aspect of the conference, but very positive experience.
Yeah, and they increased attendance again this year. That's 2 or 3 years in a row where they've been successful in increasing attendance. And I think the Board of Health Tract is a great addition. This is year 2 that they've had a Board of Health Tract. And so when that information comes out again next year, the Public Health Conference is always in April. So keep that in mind. If that's something that board members want to participate in next year, we'll watch for the information, share it, get the scholarship so that we can take advantage of that. And they move it around the state. So last year it was here in Helena. Billings, my guess is Missoula next year.
I had one comment. So when we had our meeting, just the private meeting for the budget, you doubled the advertising and messaging.
I did.
Was it because of The keynote,
No.
something that you learned?
Yeah, no, it was actually because Amber, our communications specialist, has really been advocating that she have more resources to work with. She does really great work getting our messages out in lots of free spaces, but she really does need a budget so that we can have greater impact with our messaging.
Okay.
So she's been asking for it for a couple of years.
I heard a radio ad on the way here.
Yeah.
It was like, that is apropos.
There we are. Yeah, and we have grant money too, that if it's a very specific project that's grant funded, she has money to do that, but public health in general, often she does not have money to work with, and so I wanted to make sure that she had some money to work with.
And it wasn't that much, if I remember right.
Yeah,
Not that
and
much.
at 4,000.
Yeah.
We increased it. It's a total of 9,000 in advertising for the year. So
That gets eaten up pretty quick.
it does, yeah. Well, and to do anything, especially in the media realm, you have to saturate the market.
Yeah.
You can't do that if you can't do TV and radio and like all the different things. And so she relies really heavily on social media because it's free or cheap. And so we're pretty successful in that way, but we lose a lot of audience members because there's people that aren't on social media platforms. So yeah.
Yeah.
Yeah. Anything else about that?
No. Thanks for attending.
Yeah.
And letting me put you on the spot for
All right. Announcement.
Yeah, and I have handouts, but I didn't print a bunch out, so I'll just, as I talk about them, we'll pass them around. If you want to keep a handout, great. I'll probably do some follow-up emails to board members. It makes me think that Monday.com is going to be very appreciated by you all when we finally get to launch it. The plan is May, that we'll be ready to have Sandy demonstrate it and get you using Monday.com. It's things like this that will be easily posted and you can just see what's going on and I won't have to spam you with email. But there's lots of things happening. So I wanted to make sure you all aware. Tomorrow is the Journey Home opening. So this is the information. I'll pass it around tomorrow from 11 to 3. And the address for the Journey Home is there. Feel free to take a picture of it if you don't want the piece of paper. The other items are the Rodney Street Block Party is coming up May 17th. It's a Saturday from noon to 2. And it's going to be right on Rodney Street. We've done this now for several years in a row, and it just keeps getting bigger and bigger. The purpose is really mental health awareness. And so they have really great resources there, and it's family friendly and fun. So I do encourage you to come down and take advantage of that activity that we are part of hosting. Excuse me, it's not ours solely. We are a partner with many organizations to do the Rodney Street Block Party. The next is a documentary that we are hosting at Myrna Loy. It's called Wake Up. It's stories from the front lines of suicide prevention. And so this is an opportunity to learn more about lethal means safety and its role in suicide prevention. So the Safer Communities Montana Coalition and our staff here at Lewis and Clark Public Health will be hosting this on May 20th, 6 p.m. at the Myrna Loy. So there's that one. And then the final fun thing is our neighborhood block party initiative. So this is an initiative that was born out of our previous strategic plan. We talked in our previous strategic plan about finding ways for the community to reconnect. And we talk about finding ways for the community to be prepared for emergencies and disaster. And we also talked about in the fifth initiative number 5, ways to build a better positive perception of public health in the community. And so this neighborhood block party initiative kind of checks all those boxes, and it's fun. So what's happening is that we've put out an application on our website, and we're asking that a neighborhood champion get their neighborhood together and do a block party. The money that we have been able to collect has no strings attached. So we're able to give a $500 stipend to a neighborhood in order to do this. What we're asking for is that they think about it being completely inclusive, like don't exclude the neighbor down the street because you don't like how his dog barks, right? But you need to include your whole neighborhood. And then we're giving lots of like resources and kind of technical assistance on how to do it. Checklists of here's things to think about, because one of the biggest barriers for neighborhoods to do this is that it's kind of overwhelming to think about, like, how do I go about having a neighborhood party? The city has different rules than the county, that has different rules than East Helena. So we have collected all of that information and posted it so that people that are in different parts of the county, they can look specifically at East Helena and say, oh, this is what I need to do in order to throw a neighborhood party in East Helena, and this is what I need to do in Helena, and so forth. So we've put all of those resources together for people who want to do it. Applications are going to run through the end of May, I think. The little flyer doesn't say. It's because we want you to go to the QR code. We're collecting applications through May. And again, we're going to prioritize neighborhoods that have never done it. So we know that neighborhood parties are happening and they happen every summer. But what we are trying to encourage are the neighborhoods that have never done it. Really encourage them to get together with their neighbors. Another element to this is preparedness, disaster preparedness. We know that intergenerational connectedness helps people survive when there's disaster that strikes. So the elderly neighbor next door who needs help when the snow falls, if you don't know your neighbor next door that needs help when the snow falls, then that's a problem. Or if something bigger like flood or, earthquake, God forbid. So if we get to know our neighbors, then we're able to help our neighbors when disaster strikes. And so we're really encouraging, as a part of the neighborhood party, we have some resources for neighborhoods to use as they gather to talk about, like, oh, this neighbor has a contractor and he has lots of ladders, for example. And so if somebody needs a ladder in the community or in their neighborhood, then they know who to ask, right? So it's really just, hey, let's get back together again and let's get to know our neighbors again. And it's really a public health protective factor that when neighborhoods are connected, then we have healthier communities. So it should be a really fun initiative. And I'm looking forward to seeing kind of the outcome of all of that as we select the applications and fund some neighborhoods and get some pictures back again. But we're not putting any strings attached to the money. It's just prioritizing neighborhoods that have never done it and encouraging them to be inclusive of all their neighbors. So, yeah.
And that's going to be advertised on social media and radio, newspaper.
Well, this is one of those initiatives that we don't have a lot of funding.
Okay.
So Amber is getting pretty creative about getting the word out about it. But yes, it should. Lots of social media. I don't, do you all do Substack? I think, yeah. So we have a Substack and we did that as an alternative to, we used to have a column in the newspaper. And that relationship kind of fell apart as things changed at the IR. And so we lost our opportunity to put stuff in the IR. So we started a Substack instead. She's been, Amber pushes like press release type information out on our Substack.
She had a
And
great
so-
article last week.
Yeah, yep. So in lieu of getting emails from me, if you
Subscribe.
thank you. If you I was gonna say like or something. You subscribe to our Substack or follow it, then you'll get those directly from her. Yeah. So that was a list of all the upcoming great things that are happening. And it's that time of year. It's time to get outside. It's time to have block parties. It's time to,
Well, yeah, unless,
Bad day to talk about it.
yeah.
Yesterday would have been okay.
That's nice.
Yeah. You'll see the mobile van get active again now that winter's over. Spring is here.
Sometime in July, I think.
Yeah. Yeah, in partnership with Peerview, that mobile van will make its way through the community and different parts of the county. So you'll see it out and about more again.
Great, thank you, Brenda.
That's all I had for the board today.
Do we have any public comment on any other items under the authority of the Board of Health? Right, thank you. Well, with that, we will adjourn. Thank you.
Early.
Yeah.
Notice block party. Is there ever gonna be a time where we can go to the dump on the weekends? I'm sure you've gotten a few calls.
The hope of the summer, it's since Republic took over, they kind of.
That's fine, if you wouldn't mind.
Have
really.
two roll-offs available behind.
I need to
wait for
find
it. You need to do
the
it.
strategic plan.
Like some branches.
Well, I'll have Sandy send it to you electronic.
Some stuff there, but there is a spot there to cover it there as well.
Yes.
I didn't realize.
Yeah.
That until.
Still do the-
Yeah, and we didn't print.
Well, sure.
Well, I'll just
Once a year.
electronically and you can
You
throw
know,
a
yeah, you
signature
call spring cleaning, you call spring pickup.
for the reminder.
For yard waste, we do once a year and
Bam.
it'll be pretty soon. Well, it'll be on your.
I think this is-
I'll tell you what it is.
The nurses.
Nurses. Yeah, it'll be email, it'll be email, the same information comes out that, but yeah.
I wrote down
That's our once a year thing. And then we also have the.
pregnancy, co-located or integrated care.
Yeah, we're not.
You ever,
That.
if there's ever a
Our hope is
family
summertime.
here interested in
We've
doing
tried to-
that.
Mhm.
I mean, that's my.
Well, it's them, we're getting a bunch of.
That's something.
That sounds like